For over 80 years, Dominican Hospital has provided state-of-the-art compassionate health care to the community of Santa Cruz. Our vision is to assure that every community member has access to health care, regardless of their station in life and their ability to pay.
There's a big vision for graduate medical education at Dominican Hospital here in Santa Cruz County, born out of a local need and also spawned with a national sense that we need to do everything we can to support our communities, our patients, to realize their full health potential.
We want to make sure that our patients have doctors who look like them and who feel comfortable with them. And so we were very excited to be selected to be part of the More in Common Alliance. The More in Common Alliance brings together the expertise of Morehouse School of Medicine with the facilities and the opportunities of Common Spirit Health, especially here locally at Dominican.
Morehouse School of Medicine has decades of experience in graduate medical education. Common Spirit has dozens and dozens of other graduate medical education programs in California and nationally. What does that mean for us? While we're new, we're not.
This is going to be a chance for us to train the next generation of healthcare providers. And that's a really big portion of how we proceed in our mission.
For a long time, we've all heard about all the disparities in healthcare and healthcare equity, but it's hard to know as an individual what to do to help. And this is something that I think is really going to inspire our medical staff, inspire our healthcare system, and help our community create something really great.
So what we're looking forward to is introducing 8 residents to our community, having them work with our community partners, and then also working here in the hospital.
You're going to learn about the acute inpatient, you're going to learn about the outpatient, you're going to learn about the community and how they all connect. And there's nobody else to compete for the knowledge you're going to gain. And so it's just going to be a really great experience for our residents, I think.
Salud has been in this local community for over 40 years, and we provide comprehensive health care, and we address social needs, including helping people to enroll in insurance, food stamps, housing, all of those types of issues that impact a person's health. Our community health services addresses those needs. Salud will be working with the residency to provide training in obstetrics and gynecology and pediatrics.
The residents will start their morning on labor and delivery. Many of the residents will then go to an outpatient clinic that serves women and children, and one resident will stay and provide inpatient care.
The inclusion of diversity, equity, and a sense of belonging is very important to any training physician. And Salud really does have that to its core as an organization, but also with the physicians they employ. There's so much focus on community service and really looking at health and equities from what we learn from patients and not from a model of what we know statistically exists.
I think if you don't train in this type of an environment, you might not be aware of what's available to people who don't have insurance or who are covered by Medicaid. There's a lot of services that are what we call wraparound services in FQHC that help to address all of the social drivers of health and help to meet the needs of patients who come to our clinics.
We really serve our local Santa Cruz County community, which is vastly diverse. There's a certain element of trust and hope and support that patients can get here from their medical team and from their mental health team. The degree of humanity that goes into this work, the people here really make this place. The residents will have exposure to our entire practice. They'll be part of our team. They'll have their own panel of patients assigned to them. They will be the primary care providers of those patients. We use a care team model. They'll have a morning where they'll see that variety. The patient who has a sprained ankle, the next patient has diabetes, the next patient has substance use disorder, and they'll see how different team members will step in for some visits and step in for other types of visits. It really allows everyone to feel completely fulfilled and to be experts in what they do and translate that into caring for the patient. And so the amount of collaboration and discussion and shared approaches to things is part of why I think we're successful.
We have a mentor who is a person that will support you as you go through your training and who you meet with regularly to discuss the challenges and maybe get some advice or maybe just get some praise.
You know, to quote a mentor of mine, we not only want to get residents from good to great, but we want to get them from great to outstanding. And we want to identify when residents are struggling in certain areas. So out of love and out of caring, we can help them, and we can help them get past their struggles and, you know, become the best physicians that they can become. And feedback is going to be huge, informal in the moment, formal written feedback. So really just meeting regularly as a village to talk about our residents and help them in whatever way we can.
I want each resident to be reminded of why they went into medicine. I want them to constantly be rekindling that excitement they had when they applied to medical school. I want each resident to develop a deep love of their work, their patients, and the community that they serve.
A positive learning environment is key, not a punitive one. It's scary enough to have someone's life in your hands. You really need the support of the people working with you to say, you got this, and let me help you have this. We also will have a wellness program that will build on their strengths to buttress against their vulnerabilities to make them stronger, healthier, and more powerful individuals as they leave our program.
You're kind of in this place that is also just beautiful and has the ocean right next to it, but also able to see a lot of different medical diagnoses and treat a lot of great patients. And so I think that'll be really exciting.
Everyone is gathered around this concept of ensuring that we all have joy, we all have well-being, and that allows us to take that energy and make persistently better things happen for the patients we care for. Related to the big question of why should you come here?
Está buscando comunidad. If you're looking for a community.
You should come here if you want to be an excellent doctor when you leave.
You should come here if you really want a vibrant community setting, definitely an atmosphere of inclusion and really thinking about justice and equity in a larger context.
If you want to know 90% of what you need to take care of an entire town, an entire village, including problems of acting as a community advocate, including addressing inequities in the healthcare system, including unconscious bias on the part of yourself and your colleagues, come here.
If you value compassionate patient care, if you value diversity and equity in medicine, mental health and balance, you know, if you value learning and teaching,
You should come here if you're looking for an exciting initial opportunity for shaping not only your medical career, but the future of an important medical training program.
If this mission that we're serving here fits with your sense of purpose, this is the right place.